numbed it, obviously, melted with the Vaser. So now we're whittling down the fat in the gland and sculpting him beautifully. I remark them, always remark, and always wash them down. So now we're spending some time to define his muscles. It's not all about liposuctioning to liposuction, get everything, every last bit of fat. We leave fat where we want it, we remove fat where we don't want it, and not with him, he doesn't need it, but we add fat where we want to enhance the muscle. So these lines are my roadmap. They show where the muscles are, and great about under local because I can move them. You're going to see the lats now start to pop in a minute. Let me just get some of this beautiful fat out, as you can see. And this is Power Micro Air. I'm using a 4mm long to do the initial work, and then we'll use some curved indentments to fine-tune the muscle definition. So at first we're making lines and then shadows. So in a minute you're going to see this lat pop. And you know, I use the pull-out method. Okay, this is the pull-out method. Boom. There you go. Spooge all over the place. There you go.
Dr. Lebowitz is almost at 50K subscribers, so make sure you like the video, subscribe, and we'll do more live content. If you guys have any questions, we love the community, so if you guys have any questions, feel free to post them, and we could ask them live.
So now we lift this arm all the way up. See the lat starting to pop right there? See, I want to maintain the volume of his lats.
This is under local anesthesia, so you can see the patient's arms are lifting up, which gives the doctor more space to do his work.
Yeah, you all right? What about local? If he feels a little bit, we give him a little bit more. No biggie.
Oh, yeah. Give us a thumbs up. Right hand. Yeah, you guys see that? We got people from Dubai. Let's see.
Lift up your hip a little bit here. See what I'm doing now? He's lifting, helping me. We will be turning him on his side in a little bit. But lifting up his hip so I can get around. Don't want to make him into a SpongeBob SquarePants. Good. All right, still have to work on this gland.
It's grabbing that pit, and you guys are gonna see that's gonna get smaller and smaller throughout this process. That's why when you see patients, their recovery, the incision is very small. It's because he whittles it down before he gets in there and takes it out.
Yeah, absolutely.
So it's just one of his many techniques. We can't tell you them all because, you know, then you'll be doing this at home. Usually the procedure takes something like this, would take 5-6 hours.
Yeah, 5.
You know, we start bright and early, 7:30. We make sure that all the paperwork, everything is done beforehand so we can get right to it. The patient, we finish, you know, this is obviously, it depends on the patient, but roughly around 1 o'clock, and the patient's out by, you know, 1:32. When it comes to playing sports and lifting heavy weights, wait about two weeks for that. You know, definitely recommend going for, you know, a walk, and it's good to stay active, but don't do any heavy work for a couple weeks.
So now I'm down by the semilunaris. Still working on the top here. I've got my numbers I want to get at.
So we actually give 2 compression garments. Right after the procedure, we give one that's it's like kind of like a button up, and you wear that for a couple weeks, and then once you're not as sore, we give you a pullover to wear. Usually wear that for a couple months.
So now what I'm doing here, I'm attacking, just like when I did the vaser, I'm attacking this gland from a slightly different angle. Again, I'm whittling it down so that there's no concavity, very little or no damage to the muscle or anything, and I'm doing some nice sculpting. You know, unfortunately, I think we're not doing any pectoral lipofilling, but you know, you can always do it. He's going to have a little fat down below. If he wants it, come back, we do his lower ab or whatever. You all right? Mm-hmm. Yeah, I'm scraping his rib. You want to have ribs here. Sorry about that. You're doing good. Alright, so from here, we're getting there. We got 700. I'm going to go from this side.
Yeah, we got 700 so far.
Yep. Go from this side. And get under this gland this way. Alright? Mm-hmm. There we are. Okay. Good. minute, I'm going to give him a little magic pill too. Give him give him the anti-nausea med first. And give him a little water first. Always wet the palate before you give that. Otherwise it'll stick like just a hairy desert. You alright?
Because this is under local.
Yeah.
Go ahead, Doc.
So we're giving him a little, Kathy's giving him a little anti-nausea med.
Underneath your tongue, you're just gonna actually undo what for. You're gonna let it dissolve underneath your tongue.
I'm just doing that, I'll work a little bit on the lower part.
Don't swallow it. Just
And this is the care we give to our patients, you know. That's the benefit of under local is we can communicate with them, and we have, you know, local anesthesia just on the side, just in case. But the patients are usually pretty comfortable.
Oh yeah. But it is under local, you know, so it's a little give and take. But I think I do a better job under local. They're moving. You know, there's an argument. Go to sleep. You don't know what's being done.
And what's being said, too. You don't know what they talk about.
Yeah.
I'm glad I went this route.
Yeah, they talk about how small this guy's penis is, you know. You'll never know that, you know.
Kathy.
This way I can hear Dr. Lebowitz say how nice it is.
Kathy. His mask is Yeah, you're hearing from the patient right then and there. He's happy he went down this route. And that's the thing. He's gonna right when he's done with the procedure, he's out of here. He's not in a hospital, and with, you know, COVID and everything going on, there's only
go get a slice of New York pizza.
Yeah. There's only 5 people in this office right now, so there's, you know, including the patient, yeah. We only have 1 patient in here, you know, per procedure, so it's all his attention. All the attention is to him.
All right, so I'm working on the midline here. Nice. We're gonna go over. Good. Relax for a minute. Let's see what I'm gonna do. Right over here.
Look the other way, my friend. Thank you.
Here we go. Let's get a little semi-lunaris here. Good.
If you guys have any questions, or, you know, if you want to talk to Doc one-on-one, there's a free consultation he provides via, you know, Skype, video, WhatsApp, all of that.
You got, I got.
And email him, call him.
Just don't ask me 2 things. I hate when people ask me, does it hurt? And just how much without seeing you. You say, you know, I can't. I don't know if you're 150 pounds or 250 pounds. You know, it's like doing a roof. You know, you hire a roofer, and you go call up his office. You know, pretty secretary answers. You know, probably the roofer's girlfriend. You say, how much? And you know, she'll say, well, how big is your house? You know, kind of thing.
Good analogy.
Good analogy. You know, and what kind of shingles you want? You want cedar shakes? You want, you know, architecturals? I know all this stuff. You know, you want a tin roof? You want copper? You know, it's many things. Like a painter. You know, call a painter. How much to paint my house? Oh, huh? They give you a house. And most people give free estimates, and I do the same thing. I'm going down.
So we got, look at that, guys. Almost 1,200.
We're almost there.
Almost 1,200. Then we're gonna take a short break.
In a minute, yep.
In a minute.
Another 200, we'll take a little short break.
And that's the thing, he said before he needs to go to the bathroom, so.
I know. I got you, baby.
You've heard at least 10 stacks depending on the person. Maybe, maybe not, I don't know. Call him. But yeah, that's the thing. The patient said he needs to go to the bathroom, so.
All right, go on your side a little bit now. Go on your side, the left side down.
And that's how much we got so far, guys.
All the way, all the way. Yeah, go for it.
Look at this, guys. Look at what we're doing right here. He's on his side.
Your arm a little bit. Good.
That's the benefit of local right
All
here.
right, so now we're gonna get over here a little bit. Etch this. Another couple hundred. You all right? Mm-hmm. Oh yeah, Mr. Last popping here, baby. Yeah. See over here a little bit.
Yes, there are medications to take pre and post.
Yeah, it's a whole, I have a whole big thing. Whole big protocol.
February 24th, Adam. We'll see you then.
Now this guy, we're gonna take some of the fat and stick in his penis. He wants that.
Yeah?
Yeah,
All 4 liters.
all 4 liters.
All 4 liters in the
He
PP.
wants a Guinness. He wants his penis to look like a Guinness.
Welcome to Jamaica, have a nice day.
Welcome to Jamaica.
That's a nice kielbasa, you know?
Yeah, gotta strap it to his stomach.
Life will run.
Alright, we're almost done. It's gonna go over in a minute.
Look at this, guys. It's about to go over. Look at that. Ooh.
Let me just a little bit over here while I got him. You alright? Finish up here a little bit.
As I told you.
All right, guys. So we're gonna
Yeah, we're gonna break for a second. We're gonna give him a break.
join us on Instagram Live.
We'll finish up the other side.
We'll finish up the other side. If you guys have any questions, bring them over there. And hopefully we see you guys there. Like, subscribe. We're almost at 50K. That's a big milestone.
Yeah.
So appreciate you guys spending the day with us, 20 minutes. And have a good one.